On health, but this time around let's focus on malaria, as slum dwellers in Dagombaline are advocating for periodic larvicide to help curb the high incidence of malaria in the slum. They say their mosquito nets have been effective because the nature of the environment. Here's a report by Beatrice Spielgabra.
The National Malaria Control Programme is targeting malaria elimination and zero malaria deaths by 2030, in line with the Sustainable Development Goal 3. Dagombaline, popularly known as Bola Bola, is one of the biggest slums in the Ashanti region. Congestion is a major challenge here, with the wooden structures built closely to each other, making movements within the passageways difficult. Sanitation in this enclave is a major issue. Lack of a toilet facility means eating in the open. Refuse is also dumped indiscriminately. Dwellers here are mostly from the northern part of the country who travel down south to look for jobs to sustain their livelihoods. The women are mostly head porters, with the men settling in the scrub business. Inhabitants here are prone to incessant mosquito bites. Those who cannot afford a wooden structure have no option than to sleep in the open. They become prey to mosquitoes. Research has shown pregnant women and newborns living in malaria endemic areas are vulnerable.
I always use mosquito coils, but whenever I go to the hospital with my sick child, the child is always diagnosed with malaria.
At Dagombaline, over-the-counter drug shops are spotted at vantage points. Anti-malaria drugs dominate the drugs sold in these shops. One of the sellers revealed patronage of anti-malaria drugs are always on the increase.
The kind of drugs that we normally sell here is sometimes the anti-malaria drugs. That is the high patronage here, most especially the anti-malaria drugs. It will get to a time that if you didn't go in for more supplement, you short it here.
Ghana is currently at the control phase of malaria elimination and zero malaria deaths. The National Malaria Control Programme has instituted a number of interventions which include distribution of long-lasting treated mosquito nets and larviciding, where breeding places of the mosquito larvae are sprayed. But chairman of the United Kayaye Caucus, Abubakar Aminu, does not recollect the last time the women were supplied with the nets or their drains sprayed.
We've never seen something like that. Even fumigation that they've been going around spraying all over the place, no, something like that has never happened before. We only appeal to them to pay their attention in this area, because these are the most serious places that they must take care of. So we need their intervention, their help, so that we can also have access to the free distribution of mosquito nets.
At Ariam Clinic, which is situated near the slum, Medical Director Dr. Gabriel Boachi mentioned malaria as one of the leading OPD cases, with some patients coming from the slum. He wants a total re-engineering of the place as a measure in reducing malaria cases from the community.
Where they are staying, need a lot of bioengineering must be done. We need to construct drains. We need to, improve the living conditions of the people there. So long as they continue to live in there, malaria will always be a problem.
Asokore Mampo, Municipal Health Director, confirmed malaria cases have since 2018 seen a decline from 17,000 to 3,000 in 2020. This, he believes, is as a result of intensified interventions such as the distribution of mosquito nets and selective larviciding.
We demarcated about 17 sites where there are a lot of slump there, and then the water, stagnant water there. So we did a spraying to kill the larva of the malaria and malaria parasite. Because of that, it has also reduced the cases of malaria in Askomampo.